Good morning, everybody. Thank you for coming to Nathan Hale today. I would just like to thank you for sharing space with us as you work for this important work today. So I am Jolene Grimes, the proud principal of Nathan Hale High School. Welcome.
Thank you, Principal Jolene Grimes. We appreciate this opportunity to be here. I'm gonna just move this up a little bit. I'm probably the tallest one up here, Dr. Khan and I, so. Okay, maybe I won't move it up. Well, good morning, and thank you all for joining us today to discuss just a critical investment in Seattle youth. My name is Dwane, Dr. Dwane Chappelle. I'm the proud director at the Department of Education here at the City of Seattle. And within our department, our mission is to ensure that every young person has the tools and support they need to thrive both inside and outside of the classroom. And we're extremely proud to partner with 7 incredible organizations that bring a deep understanding of our community's unique needs and challenges. These amazing organizations will deliver evidence-based, culturally attuned care that meets youth where they are and empowers them to navigate life's challenges with resilience. This $7 million youth investment in mental health services reflect our commitment to equity and access for all of our Seattle youth, particularly those youth from communities that are least likely to encounter care that honors their backgrounds, identities, and needs. So by introducing telehealth, we're breaking down barriers like cost, the stigma, and lack of culturally appropriate care, ensuring that those resources are available whenever and wherever they're needed. The community-based telehealth initiative is part of our broader strategy to support students' mental health through school-based services and community partnerships. As we begin to roll out new services with these 7 provider organizations, middle and high school age Seattle students can continue to access health care, mental health care, through school-based health centers on campus at 21 of the Seattle public school sites. And our young folks also have access to free virtual therapy, unlimited texting, and monthly one-on-one sessions with a licensed therapist through Talkspace. This comprehensive approach that is community-based telehealth, school-based health, and virtual care, it aligns with our greater vision of promoting student wellness, creating equitable opportunities for all youth to succeed, not only academically, but emotionally and socially. So I want to just thank Mayor Harrell, excuse me, I want to thank Mayor Harrell, our city council, our provider partners, and the community for their ongoing support in prioritizing youth mental health. I also want to thank our young folks for their commitment as well. So DEEL, we now invest to build on the foundation of equity and access, which is at the heart of One Seattle like Reach Out. So thank you again, Mayor Harrell. So what I want to do now is introduce Mayor Harrell to come up for a moment.
Thank you. Thank you. Thank you, Dwane. I'd like to begin by thanking again Principal Jolene Grimes Edwards for letting us into your house of learning, your home of learning. So last night, the superintendent and I were at a high school, and we were high school students again enjoying a basketball game. And I took full advantage of that to brag to a senior who I was when I was a senior. I think I bored her because I'm joking. I only said something, I was a senior like you. But I really had that conversation to understand what goes through the mind of a student now, because times have changed. The level of trauma, the level of fear, the lack of safety with gunfire has changed. A week ago, I talked to many students, and they asked me the question, why did I become a lawyer? And I said, because I learned at a very young age the power of words. Words can drive people to kill. They can drive you to tears. They could also inspire you and bring you tears of joy. I told the story of when I was 13. I remember I was playing basketball at Garfield, and I walked 8 blocks with a friend crying over something that had happened on a basketball court, just words. And so I thought how cool it would be to be able to learn words and articulate words to do good. I level set with that story to talk about the $7 million investment going to 7 local organizations will help us optimize the power of conversation, of healing. I'm excited to be with the Department of Education and Early Learning to announce this. These organizations include the Asian Counseling and Referral Service, Consejo Counseling and Referral Services, June Care, Seattle Children's Hospital, Odessa Brown Children's Clinic, Seneca Family of Agencies, Southwest Youth and Family Services, the Therapy Fund Foundation. The power of words and the power of cultural competency, the power to reach young folks where they are. The diversity of these organizations reflect the diversity of our communities, ensuring that our youth have access to this kind of care, who understand their backgrounds and their lived experiences. Our strategy will be focused on prevention, early identification, and intervention, and expanding access to treatment, both in person and virtual. So we don't take youth mental health for granted. If you look at what my administration are trying to do, as I said yesterday when there are a bunch of little toddlers on the floor, I said a lot of what we do are just for them. Some of us are in what I call the 4th quarter of their life. Now let me explain that. So you get 20 years a quarter. So first 20 to 40, that's second quarter, 20, 40, 60, 80. I know someone says, well, what do you mean, you die when you're 80? I says, no, every 5 years is an overtime period. So some of us are going to go for 3 or 4 overtimes. But as we get into that 4th quarter of our age, that we really look back and ask, what do we stand for? And I think all of us here are now standing for that next generation. So that's what this investment will do. Last year, we had over 18,000 youth participate in our teen late night programs at community centers. We recognize that since launching this a month ago, over 100 students have accessed free telehealth support through Talkspace. So as I relinquish the microphone, I just want to impress upon everyone that could hear my voice. The power of words are so almost immeasurable. And we're going to invest because we want to save and protect and love our youth. Thank you very much.
Thank you, Mayor Harrell. So now I would like to welcome up our amazing Superintendent, Dr. Brent Jones of Seattle Public Schools, to speak about the power of partnership in support of youth mental health for students, families, and educators. Let's welcome Superintendent Jones.
Thank you, Director Chappelle and Mayor Harrell. Good morning. It's a privilege to be here in beautiful Nathan Hale. Seattle Public Schools is unwavering in our commitment to provide safe, inclusive, and supportive learning environments for every student. This is our foundational priority. This summer, the mayor and I came together with a shared vision to create an ecosystem of safety for our students, one that encompasses both the physical and socio-emotional well-being of our students. Alongside the dedicated efforts of the mayor, Dr. Chappelle, and the DEEL team, we've made important strides in ensuring our students feel secure and empowered to be their authentic selves. At SPS, we are a teaching and learning organization, and we believe that for teaching and learning to take place, our students must be well mentally, emotionally, and spiritually. The city's partnership has been invaluable in this journey. Our students have spoken, and we have listened. They face increasing mental challenges as they navigate the complexities of today's online and physical worlds. Through our partnership with the City of Seattle's Department of Education and Early Learning and mental health organizations, we are expanding access to critical services and resources. These will help our middle and high school students manage stress, anxiety, and other mental health concerns. So we are committed to meeting students where they are, including through the telehealth options that they've asked for. By investing in mental health resources now, we are laying the foundation for the long-term success of our students' well-being and them becoming our future leaders in that fourth quarter, or that second quarter, or that third quarter that Mayor Harrell talked about. This initiative really will empower our students to build resilience, emotional intelligence, and coping skills to serve them throughout their lives. Mental health matters. It's complex, it's multifaceted, requiring a diverse range of expertise. When educators, counselors, mental health professionals, and community partners come together, the support we provide becomes more comprehensive and impactful. Together, we can ensure our students receive the support they need to thrive. Thank you. And I will now turn it over to Anya Peterson, a 10th grade student here at Nathan Hale as a member of the City of Seattle, Seattle Youth Commission. Anya, we're proud of you. Now over to you. Thank you.
Hello, and good morning to everyone. My name is Anya Peterson, and I'm a 10th grade student at Nathan Hale High School, as well as being an at-large member of the Seattle Youth Commission. Today, I was asked to share about why mental health resources are so crucial to students in this day. I would like to start by bringing us back to almost 5 years ago today, when we first found out about COVID-19. Many students, like myself, struggled with the idea of being forced inside for over a year. And while many people might have originally enjoyed the idea, by the end, we could all feel the weight and effects that staying so far from each other had led to. As we returned from that year, hidden behind a screen with the ability to turn off our camera and shut ourselves away from the world whenever we desired, we found that our mental health was one of our newfound biggest challenges. Looking around, we are all navigating the demanding landscape of academic life. Whether it's through exams, deadlines, or the constant expectations from those around us, our mental well-being often becomes a subject of concern. Additionally, with part-time jobs, extracurricular activities, and other obligations outside of school, the pressure can lead to added stress, anxiety, and even depression. As I think about my own life, I can see how much mental health has an impact on the people near and dear to me, whether it be their smiles not quite reaching their eyes, or an anxiety of fear that wasn't there before. By providing mental health resources, such as counseling services, therapy sessions, and support groups, we are giving students a safe space to express their feelings and hopefully lift some of the burden. By also adding more resources into schools, we are providing immediate, safe spaces for students who may not have that comfort at home. Mental health resources also help to play a vital role in personal development. Access to resources empowers students to navigate challenges with resilience and equips them with the tools needed to be successful in both academics and healthy relationships, thus building a stronger sense of self-worth. By providing mental health resources, we are also preventing the stigma that is associated with mental health issues, in turn normalizing and encouraging students, hold on, I need to flip the page, to seek help without the fear of judgment, leading to a community of understanding and value amongst each other. Finally, by investing in mental health, we are investing in our future. The students of this generation are the leaders of the next. They are the innovators in and out of the classroom and are bringing change to tomorrow. By fostering a positive atmosphere and prioritizing mental health, we are nurturing a generation that is resilient, empathetic, and capable of addressing the challenges of the future. In conclusion, us as students are immensely grateful for the work that is being done to raise awareness about these issues and for the resources that are being made available for us to use. Remember, mental health is just as important as physical health, and together we can break the stigma and pave the way for a brighter, healthier future for all. Thank you.
That was fantastic. Thank you, Anya. But before we move on, I just wanted to make a quick announcement that our council member who's in this district, Rivera, very much wanted to be here, but she couldn't make it today, so she sent something for me to read. Council member asked me to let you know that she wholeheartedly supports this investment into the well-being of our middle and high school students. These awards are trusted providers of high-quality, diverse, and evidence-based mental health services, both in person and virtual. It is important that all middle and high school students at Seattle Public Schools can find the care they need. These kids have endured a pandemic and are now dealing with gun violence at their schools. Those are large, difficult challenges for anyone at any age. As a SPS mom, I am proud that we have mental health counselors in place to help our students. Now let's ensure they know how to and feel empowered to ask for help. So I wanted to read that from Councilmember Rivera, who couldn't join us today. So once again, thank you, Anya, for joining us and shedding light on the realities that young folks in our communities are navigating. So we honor you for being a leader and a change maker for your peers and the greater community. Let's give her one more time a round of applause. So the program and resources we're introducing now informed by the priorities of our youth and families, where we are listening and are energized to expand available resources and supports to meet the needs that our young people have identified. One mental health care priority we have heard loud and clear from Seattle Youth is access to culturally responsive care. So I would like to now welcome Ashley McGirt, founder and CEO of Therapy Fund Foundation, to share a few words about their innovative program model, their dedication to serving Black and African diaspora youth and communities. Therapy Fund Foundation is one of our 7 telehealth awardees for community-based youth mental health services. Come on, Ashley.
Thank you so much. As the CEO and founder of the Therapy Fund Foundation, I'm thrilled we are able to expand our reach with the free therapy services that we provide to our youth. Mayor Harrell shared earlier, someone asked, are we gonna live to be 80? And it made me think about why I do this work. My grandmother died at 62 years old from a stroke. The leading cause of stroke is stress. My grandmother was extremely stressed out, and I often think about the trajectory of her life and if there were therapeutic supports available to her, would she still be here? And would she have managed her stress in other ways than the ways that she did that actually ultimately led to the end of her life? And following her death, my grief turned to major depression. I grew up not too far from here, and I went to a predominantly white school. I ended up seeing the school counselor, a white woman who didn't understand the role of grandmother in Black families. I found myself at 10 years old having to educate her on race relations in America. And I never got the healing that I needed. And so I actually wanted to be a lawyer, but I pivoted and I started studying psychology and mental health because I knew that there were other Black children, other children of color who were suffering and didn't need to explain what they were going through to their counselor or have to explain their culture, that they needed someone who represented them. And being a Black clinician, we're a unicorn. There's only 4% of us throughout the entire United States. And so through the Therapy Fund Foundation, we not only provide free therapy services, we offer peer support services, we also provide free mental health services, education, and advocacy. We are more than a service provider, we're a movement for healing. Our approach to mental health is one that is rooted in anti-oppressive, culturally responsive practices, meaning we not only acknowledge systemic barriers, but actively work to dismantle them both inside and outside of therapy. We center the lived experiences of our youth from historically excluded communities and create spaces where they feel seen, heard, and empowered to heal, spaces where they don't have to educate their clinician like I did when I was their age. Far too often, young people, especially those in Black and underserved communities, are left without the resources or support they need to thrive. We have answered the calls when people in our community have experienced immense devastation from gun violence, displacement, and more. Our work bridges the gap by connecting youth to clinicians who reflect their identities, understand their experiences, and practice with compassion and cultural responsiveness. The CDC has revealed that suicide is the third leading cause of death for Black boys aged 10 to 24. Even more troubling, the American Academy of Child and Adolescent Psychiatry have found that Black youth under the age of 13 are twice as likely to die by suicide as their white peers. For Black girls, suicide attempts have risen by over 30%, and only 25% of Black youth who experience severe depression receive treatment, compared to 40% of their white counterparts. Through this work, we are changing that. I have youth who come up to me every day. They see me, they hear my story, they say I look like them, and that they're proud to be able to work with a therapist of color, a therapist who sees them and understands them, and not just myself. We have over 200 providers of color within our network that we're able to connect with youth, because we know that healing is a collective effort, and we cannot do this alone. That's where we're inviting community to join us in our mission of eliminating barriers to healing within Black and other marginalized communities. We have a small team, and we ask for your support in spreading the word, supporting the work, doing outreach so that we can continue to connect youth with clinicians of color and culturally responsive services. We are extremely honored to have this funding, because oftentimes we have long wait lists because we haven't been able to serve all of the youth who reach out, especially when there's incidents of gun violence, displacement, and other things that happen within the community. And even more now than ever, we are going to need mental health services. So we're extremely grateful and thankful to be a partner within this funding that the City of Seattle has released. Thank you.
Thank you, Ashley. School-based health centers are a foundational element of mental health services and in support for our youth. So now what I would like to do is welcome Dr. Faisal Khan. Dr. Khan is the Director of Public Health for Seattle, King County, to come and speak about partnership and ongoing efforts to ensure that our young people have timely access to such critical care. So let's welcome Dr. Khan.
I came prepared with remarks, but I'm going to digress. Our network of school-based health centers in King County is a true community asset, and we're providing lots of services, and we need to continue to fund them and empower them to do even more. But if you'll permit me, I'm going to digress because this is personal. As the father of a 19-year-old and a 24-year-old, both of whom struggled with depression, both of whom struggled with the various challenges that children today, and I use the word children deliberately because sometimes when we use the word youth, it tends to gloss over the fact that we're dealing with children, our children, who are not yet emotionally, mentally, socially developed enough to be able to deal with things the way adults would. Adults are struggling, let alone children. So anything that I cite to you in terms of statistics does nothing to describe the twindemic of depression and suicide that seems to be taking the lives of our children right now. I want to commend the team from Talkspace, CEO Natalie Cummings, your colleagues. They have truly made a difference in New York City through their work. And so to the members of the media, do ask Natalie about their work in New York City. As I was kidding with her earlier today, we tell all our colleagues on the East Coast what they experiment with, we try to perfect on the West Coast. And that's what we're trying to do here. We're trying to enable our children, kids like Anya, my kids, to take control of their lives, of their health, and put that in their hands, quite literally. That's what Talkspace is about. That's what new modalities of service are about. All these fantastic leaders that are sitting up here on the stage are fully committed to it. I could not be prouder of working with the city of Seattle, with the leadership that Mayor Harrell and his team have shown, with the leadership that the county has shown on this issue. We recently concluded the development of a comprehensive 5-year strategic plan for Seattle and King County public health. And I'll bet you can guess what the priorities were. Access to care, which means high quality medical and dental care for adults and teens, for adults and children. Substance use disorder, including the fentanyl crisis. Mental health, particularly youth mental health. Homelessness, and gun violence prevention. Now, those problems, those 4 major crises, don't exist in isolation. They intersect with each other. Some of the statistics that the Youth Risk Behavioral Surveillance Survey tells us are truly astounding. I was at a presentation at the CDC last year in which the Center for Injury Prevention shared some of the stats that they were looking at. Upwards of 40% of kids surveyed said that they had taken active steps towards making a plan to commit suicide. And I mean active steps. I asked them the same question. What do you mean active steps? Define that. Researching it, planning it out, down to the day and the time. That's how bad this crisis is. That's what we're trying to prevent from happening. So to the members of the media, I really do appreciate the attention you focus on this and the various elements of this, the various facets of this that don't get highlighted in the sanitized narratives or get lost in the multitude of statistical tables that we come across. That's what this is about. Public Health Seattle and King County is proud to work with so many partners across the region, not the least of which are in the mental health industry. We look forward to expanding those partnerships. We look forward to pouring more resources, even in the midst of resource-constrained environments. I'm using that term deliberately, Mayor Harrell. All of you are privy to the same headlines we are. The state, the county, the city are all experiencing financial challenges. But this is not a crisis that we can ignore. We have to figure out a way to do more in this space. And that's the challenge that lies ahead of us. Thank you so much. Thank you. I really do appreciate this.
Thank you, Dr. Khan. So this is truly a critical moment for our young people to access the care that they need, as Dr. Khan just mentioned. Closing the gap for youth to access mental health care, it is a community-wide effort. And we are sincerely grateful to all of our partners and collaborators for the vital work that you are doing to meet this need. Teens and young adults in Seattle, we hear you, we see you. Your mental wellness matters to us. You and your parents and loved ones can learn more about the free resources from the city of Seattle that support your mental health and wellness by visiting seattle.gov/education. If you visit this page to learn more about the school-based mental health, the virtual care options, the upcoming programs with the local providers for this spring of 2025. You can also access immediate support with Reach Out, call or text 988. You can do that 24/7. And lastly, there's free virtual therapy for youth ages 13 to 14. It is available with Talkspace. And you can learn more about that or register with Talkspace at talkspace.com/Seattle. So with that being said, I'm going to conclude this, and I'll pass this over to the mayor for a few questions.
Thank you. Thank you, Dwane. I'll ask for a few questions, but I've learned in my business, I try not to solicit them. I just want to thank our speakers. Many of us had prepared notes, but I thought you saw on a real-time basis people speaking from their heart. And I was, as mayor, I was just so pleased to see that. Dr. Kahn, I had your name, I just meant Ashley McGirt. And I'm never going to forget that name because you were very powerful. The rest of you read your speeches, so I'm not referring to you guys. No, it was very powerful, very moving. So with that, are there any questions on what we're trying to do today? And I'll count you down if there's not. And yeah. Sure. So we've earmarked for this particular program $7 million that I think is just from our general sub-fund. With the sub-department would, of course, be our Department of Early Learning Education department. We have another total, I think, $20 million for other strategies and other investments dealing with mental health. And we'll be probably rolling out some announcements on what that looks like. That's one of the reasons why I mentioned in my remarks some of the stuff we're doing in our community centers. Okay, with that, everyone, let's just make it a great day today. Again, thank you for letting us in this great house of learning at Nathan Hale, one great school amongst many great schools. And everyone, let's make it a great week. Thank you very much. Thank you.